Welcome. In this session, I'll be discussing the anatomy of the nasal cavity. And as usual, my name is Olistegi Munyini, and I'm the Daktari. So let's start with this image or diagram, the very diagram which shows you the nasal cavity there and the oral cavity there. So between the two, you have this hard palate, which actually separates the nasal cavity from the oral cavity. So the nasal cavity communicates with the external or the atmosphere via the anterior nasal apertures or the anterior nares and communicates with the nasopharynx, this is the region of the nasopharynx, via the posterior nasal apertures or the choana. Okay, so the nasal cavity is further divided into two parts: a nasal vestibule, which is lined by skin there, and the nasal cavity proper. Okay, so this boundary between the two is known as the lumen nasal. Okay, lumen nasal. Okay, so this is the nasal vestibule. This is the nasal cavity proper. But the nasal cavity proper is further divided into an anterior part, this part here, and a posterior part, which now possesses this uh, uh, turbinates. Okay, this turbinates. So this part there is actually known as the atrium of the nose. Okay, and it is superiorly it is limited by this mucosal fold known as the aganasi. Okay, aganasi. Okay, there. So that is just an overview of the nasal cavity. So what do I expect you to know by the end of this session? I expect you, one, describe the lateral wall, the roof, and the floor of the nasal cavity, and we state some features associated with this. Also, I expect you to describe the structures forming the nasal septum. Also, we will discuss the vascular and the nerve supply of the lateral nasal wall and the nasal septum. We also discuss the lymphatic drainage of the nasal cavity as the last part of this session. So let's start with the lateral wall of uh, the nasal cavity, or rather, let's start with the roof. So the roof of the nasal cavity is formed by the following structures. One, it is formed by the nasal bone. It's also formed by the nasal spine of the frontal bone, and also formed by the cribriform plate, and also by the anterior surface of the body of sphenoid. So you can see the anterior part is sloping forwards, and the posterior part is sloping backwards, but the middle part is almost horizontal. So those four structures actually form the roof of the nasal cavity. What about the floor? The floor is formed by two structures, and that is the palatine process of the maxilla and the horizontal plate of the palatine bone. Okay, so what about the lateral wall? So the lateral wall is formed by both cartilaginous and bony structures. So let's start with the bony structures, and we start with the nasal bone there, and then the frontal process of the maxilla, and then the lacrimal bone over there, and then the ethmoidal labyrinth. So the ethmoidal labyrinth possesses the superior concha there, the inferior concha, and also an uncinate process, which will be somewhere there. Okay. Also, we have the inferior concha, which is considered as a separate bone, and then we have that's the perpendicular, or rather, yes, that's the perpendicular plate of the palatine bone, which has an orbital process there. Rather, that is the sphenoid process and an orbital process. Between the two, you have an opening known as the sphenopalatine foramen, which is the communication between the cervicopalatine fossa with the nasal cavity. You also have the most posteriorly, you have the medial pterygoid plate, which also tends to form part of the lateral wall of the nasopharynx. Also, the cartilaginous structures, you have one, the upper lateral nasal cartilage and the lower lateral nasal cartilage or the major alar cartilage and some minor alar cartilages there. So those are the structures which form the lateral wall majorly. Now on to the septum. Which structures form the septum? So this septum is formed by actually three structures. So inferiorly, you have this bone. So this is the hard palate. So we have this bone known as vomer. Then superiorly, you have this, which is the perpendicular plate of the ethmoid bone. And then anteriorly, you have the nasal septum, the septal cartilage, rather, the septal cartilage interposed between the two. Okay? So that's the perpendicular plate of ethmoid, that's vomer, that's the septal cartilage. So what are some features we expect to find on the lateral wall? So I told you that's the vestibule. So that's the vestibule, and this is the nasal cavity proper. The nasal cavity proper is lined by the respiratory mucosa, the pseudostratified ciliated columnar epithelium with goblet cells. Okay, but it also has an olfactory region up here. So the superior part of the lateral wall and the nasal septum is occupied by the olfactory mucosa, which actually is pseudostratified ciliated columnar epithelium without goblet cells, but also these cilia are non-motile as compared to those of the respiratory mucosa, which are motile. Now, the demarcation between the vestibule and the nasal cavity proper is actually that lumen nasal. Now, this vestibule is lined by skin, and that skin has hairs. Those hairs are what are referred to as the vibrissae. Okay, vibrissae. Their function is to trap particulate particles, preventing them from entering the nasal cavity and getting access to the upper respiratory tract. Okay, so this is the atrium of the nose, which is limited superiorly by the aganasi. That's okay. Then you can also see we have, so that's the vestibule, that's the atrium. Now that's the inferior concha there, the inferior concha or the inferior tabinate. That's the middle concha or the middle tabinate, and that's the superior concha. In some individuals, you find another concha, a very minute one, but above the superior concha, and it is known as the concha suprema or the highest or the supreme tabinate. Okay, concha suprema. So they might be four in some uh, uh, cases. Okay, then you have these uh, channels, or rather, yes, channels which are below the content. Those are what are referred to as the metastases, okay? And it is what we discuss here. So this is that's the superior tabinate. In fact, here you can see the supreme tabinate or the concha suprema there. See, in this case, you have four tabinates, okay? So that is what this intended to show you. You have an inferior one, a middle one, and a superior one. But in some individuals, you might find the supreme one or the concha suprema. Okay, yeah. Now, what about now the metastasis? When now you have cut, this can see it's a cut surface of the inferior concha. That is the cut surface of the middle concha of the middle tabinate. So you have exposed these metastasis. So that's the inferior meatus, and on the inferior meatus, you can see that's the inferior meatus, and you can see the opening of the nasolacrimal duct. So at the opening of the nasolacrimal duct, you have a fold of mucosa, which acts as a valve to prevent uh, passage of air from the nasal cavity into the lacrimal apparatus when you blow your nose. So that mucosal fold is what is known as the valve of Hansa or Hansa's valve. Okay, so this is the middle meatus. So the middle meatus presents some features. So that feature there is the hiatus semilunaris or the semilunar hiatus. Okay, and also it presents that elevation which is known as the bulla ethmoidalis. Okay, the ethmoidal bulla. Okay, so we have some paranasal sinuses which open on on this, and I will be showing you that. That there is the sphenoethmoidal recess, and it is where this sinus, the sphenoidal air sinus, opens it. Okay, so uh, the superior meatus would be somewhere here. Okay, would be somewhere around here, and we will see which ethmoidal air cells open into the superior meatus. So this is now what I was saying. Now this is the hiatus semilunaris. The hiatus semilunaris, on the anterior part, that is where the frontal air sinus opens. On the middle part, that is where the anterior ethmoidal air cells open. On the posterior part, that is where the maxillary air sinus opens at what is known as the maxillary ostium. Now the bulla ethmoidalis is actually produced by the underlying middle ethmoidal air cells, and they open on the surface of the bulla ethmoidalis. Now on the superior meatus, the posterior ethmoidal air cells open there. And as I had said earlier, the sphenoidal air sinus opens on the sphenoethmoidal recess. Okay, so you need to orient yourself with this anatomy of where each of the paranasal air sinuses open into. So let us discuss the arterial supply of the nasal septum, which is actually important. It is supplied by the following 5 arteries. So it is supplied by the septal branches, which come from anterior ethmoidal, posterior ethmoidal. Those two come from the ophthalmic artery, which came from the internal carotid. The sphenopalatine comes from the third part of maxillary artery, and so does the greater palatine. Okay. The superior labial artery is a branch from facial artery, which comes from external carotid. Remember, maxillary artery is the terminal branch, is one of the two terminal branches of external carotid artery. So these arteries anastomose at the anteroinferior portion of the nasal septum, at what is known as the vitreous area, to form what is known as the Kiesselbach plexus. Okay, and this is important clinically because it is involved in the anterior epistaxis, the anterior nosebleeds. Okay, so you need to remember that. Okay, now what about the lateral wall? You divide it into 4 quadrants. The anterosuperior quadrant is mainly supplied by the anterior ethmoidal artery, with some contribution from posterior ethmoidal as well. The posterior superior quadrant is supplied by the sphenopalatine artery. The posterior inferior quadrant is supplied by the greater palatine artery, the nasal branches which originate from the greater palatine artery or from the descending palatine artery. The anterior inferior quadrant is supplied now by the branches from facial artery, that is, especially branches from the superior labial artery, and also the greater palatine artery terminates, supplies also this portion after traversing the oral cavity. So what about the lymphatic drainage? So for the lymphatic drainage, you divide the nose into an anterior half and a posterior half. So for the anterior half, the lymphatics drain into the submandibular lymph nodes, but those from the posterior half actually drain into the deep cervical lymph nodes, including the jugulofacial lymph nodes. But we have some which drain into the parapharyngeal lymph nodes. Okay, so that is the lymphatic drainage of the nasal cavity. And with that said, we have discussed the anatomy of the nasal cavity. So thank you very much. Before I thank you, let us discuss now the nerve supply of the actually nasal septum. Sorry for that. So we have olfactory nerves which supply the upper portion of the nasal septum. Okay, but the anterosuperior part of the nasal septum is actually supplied by the anterior ethmoidal nerve, what are known as the internal nasal branches, especially the medial nasal branch, which supplies the nasal septum. So, but the antero-inferior portion is supplied by the internal nasal branches, which come from the infraorbital nerve. Okay? Now, for the posterior part, it is supplied mainly by the nasopalatine nerve, which is this, is the nasopalatine nerve there. the nasopalatal nerve. The nasopalatal nerve is actually belongs to a group known as the medial posterior superior nerve. The medial posterior superior nerves come from the pterygopalatine ganglion, and the largest one is the nasopalatal nerve. So the other nerves of that group supply the posterior superior aspect of the nasal septum. So those are olfactory, that is anterior ethmoidal, that is the internal nasal branch of infraorbital, that's nasopalatine, and those are the medial posterior superior branches which come from the pterygopalatine ganglion. Okay, what about the lateral wall? Now, for the nerve supply of the lateral wall, we also divided into 4 quadrants. The posterior superior quadrant is supplied by the posterior superior lateral nasal nerves, which come from the pterygopalatine ganglion. The posterior inferior quadrant is supplied by the posterior inferior lateral nasal nerves, which come from the greater palatal nerve. The anterior superior quadrant is supplied by the anterior ethmoidal, the internal nasal branches, especially the lateral nasal branches. The anterior inferior portion is supplied by the nasal branches of anterior superior alveolar nerve, but also the internal nasal branches of infraorbital. Okay, and the superior most part is supplied by the olfactory nerves. Okay, so I think that is that for now. We have discussed the anatomy of the nasal cavity, and do subscribe for more of anatomy content. Thank you.